Hey everyone, welcome back to the channel. Today we are tackling a super high yield USMLE Step 2 case, one that always confuses students. When is delayed puberty actually a problem? We will go through the case, walk through the answer choices, and then finish with a high yield pearl that you absolutely need for your exam day. A 12-year-old girl comes to the clinic for her annual checkup. She feels completely fine, has no past medical history, and is not on any medications. Her height is at the 30th percentile, weight at the 60th percentile. She's never had her first period. Exam shows that her breasts are flat and only the areola following the chest contrast is visible. That's the Tanner stage 1. Pubic hair, none. Also, Tanner stage 1. The rest of her physical exam is totally normal. So the question, what's the most appropriate next step in management? And alright, let's think like the test makers. Puberty in girls normally starts between ages 8 and 13. The very first sign is thelarche, breast budding. Menarche, or the first period, usually comes about 2 or 2.5 years after the thelarche. Our patient is 12 years old with no breast development yet. Question, is this abnormal? Nope, she's still within the normal window. Now let's break down the wrong answers. FSH and LH. Answer choice A. You would check these if puberty hasn't started by age 13 in girls. She's not there yet. B. Growth hormone and thyroxine. You would order this if you were worried about short stature or hypothyroidism, but she's growing fine, around 30th percentile height. C. Brain MRI. Only if you're worried about a CNS mass, think headaches, vision loss, or anything like that. She has none of these. Okay? D. Bone age. Helps if you suspect constitutional growth versus pathologic delay, but again, she's still normal for her age. So the correct answer is E. Nothing is wrong with her development. She's right on the track, and you don't need to order any tests yet. And here's the takeaway you need to know for step 2. No breast development by age 13 in girls, or no menarche by age 15, delayed puberty. That's when you start the workup, such as bone age, FSH, LH, and so on. Until then, reassure, reassure, reassure. And just to connect with the real life, a lot of students panic when they see no puberty at age 12. But on the exam, you've got to remember the cutoff points. The BME loves to test these nuances. If you found this breakdown helpful, hit that like button, subscribe for more USMLE high yield cases, and drop in comments. What's your trick for remembering Tanner stages? I will be covering more common step 2 traps in the next video, so stay tuned.